As the topic mentions addiction, the topic of addiction, I will be talking more about tobacco and alcohol addictions, how it affects the health. Definitely a part of it, I will definitely introduce a few medications which are definitely present in the market area. However, to mention first of all, the most important part to get de-addicted is more of your motivation and support that you get from your surroundings. That will help you the most. Probably the second part, to some extent, the medicines can play certain role. As the diagram shows over here, though we understand that because of this kind of habit, we are being harmed physically, mentally, and others, and otherwise, we still continue to use this kind of medications or this kind of habit continues in ourselves. As I told you, I'll be talking more on smoking and alcohol addiction being in Indian context. The highest amount of addiction is in nicotine related, be it chewing tobacco, smoking tobacco, or other forms. And the second part, I'll be dealing with a little bit of alcohol addiction also. Now, there are two parts of nicotine addiction. One part is called the positive reinforcement, and the other part is necessarily the negative reinforcement. As we have a positive, we necessarily have a negative also. Now, the positive reinforcement is when a person is smoking, the kick that he is receiving from this particular substance abuse. The list has been over here. As soon as the person starts smoking, within a matter of 10 to 16 seconds, he gets a nicotine buzz, or he starts getting the kick. There are different kinds of addictions, as Dr. Shabyasachi Mitra has already mentioned to you, LSDs, heroines, and others. But none of those medications or none of those substances reach the brain and cross the blood-brain barrier to show the kick so fast. And that is one of the biggest reasons why nicotine is so very popular all over the world, and especially in India also. When it reaches the brain, the smoker experiences buzz, a relaxation, reduces stress, and other desired effects that you want to have from smoking. And positive reinforcement is the reason why smoker falls again for the next cigarette or the next bout of addiction. This negative reinforcement is the area which comes when the person tries to withdraw from nicotine or he abstains from nicotine, which includes certain symptoms like irritability, frustration, anxiety, restlessness, dysphoric mood disorders, increased appetite or weight gain, and insomnia and sleep disturbance. The withdrawal symptoms develop within 4 to 6 hours. Then the reason being that the half-life, the presence of nicotine in the body is pretty short. It is not more than 2 hours. Peak within first few days of abstinence. So this abstinence phase or the withdrawal phase will continue for first few days of abstinence, then typically resolve within 1 month of time. Negative reinforcement, smoking behavior, the most quitters relapse within first month of abstaining from smoking. And probably this is one of the most popular figures that you would have seen everywhere. Nicotine or smoking is one substance abuse that affects almost all parts of the body, be it blood, lungs, be it gastrointestinal system, the joints, the endocrine system, heart, and others. When we talk about smoking cessation, there are certain protocols that we have to maintain. Now, when we have an addiction, to get rid of it, it needs certain amount of time and certain amount of planning before we can do it. Otherwise, the chances of relapse or getting back into the addiction is more common. the protocol that necessarily is most famous for nicotine de-addiction or smoking de-addiction is called the START protocol, which includes you set up a date for quit, let your peers know about it. It is more helpful because you get more of inspirations from others or your peer group to leave smoking. Then anticipate and plan for the challenges you're going to face. Now, as I told you, there are abstinence phase, you will face withdrawal problems, which you need to be handled medically. And for that, you probably need to have an assistance of a medical person or a doctor or a psychiatrist probably, which you need to plan for and take a suggestion before you start up, or the kind of help that you probably would need at that moment of time when withdrawal is going on, or to recognize that problem of withdrawal. Then remove all the cigarettes. That necessarily means not only cigarettes but matchboxes, ashtrays, which can remind you or which can give you a reminiscence of you were a smoker. And talk to your doctor definitely before you can plan all this. There are different ways that you can go for, and there are non-pharmacological methods and there are pharmacological methods. Non-pharmacological methods necessarily is known as a cold turkey method. Here, the person leaves cigarette all of a sudden. He doesn't have anything which has to deal with his abstinence period. He decides a date, he either cuts down slowly or he just stops all of a sudden abruptly. As a practical purpose of this one, many people do successfully carry out the resolution for a longer time, but it has been seen that 70% of people who do this, they relapse back into addiction within a month of 1 month. In this cold turkey, it is better to have a support group or a group of people who have the same kind of problem, who probably friends who can quit at the same time, so that they can share their own problems and they can get suggestions from them. A support group where the people who have already been in the process of the addiction can give you more suggestion about it. Then behavioral therapy, which is more of an inspiration and supportive therapy. Hypnosis is another method, and acupuncture probably, it has been told that whatever international bodies of acupuncture they have mentioned, acupuncture around the ear, that is on the auricle, helps them to reduce smoking or get rid of smoking. This is where it becomes very important to understand that this pharmacological therapies needs guidance from physicians. It is always better to have physicians' recommendations or prescription before you can go for all these programs. There are different ones. One is replacement therapy, that is your nicotine has to be delivered in a purer form. When you get it through a gutka or a smoking of nicotine, there are lots of impurities that can harm your body. Now, nicotine replacement therapy necessarily gives nicotine in a very pure form. However, because of the admixtures added into cigarette, the nicotine level in the blood picks up very fast, and that's the reason you get the buzz or the nicotine buzz so fast. However, in nicotine replacement therapy, because it's a pure form of nicotine, the high or the buzz does not get into that very high level, and that's the reason you will not have that kind of pleasure when you go for this kind of therapies, which can be in the form of a gum, inhalation, lozenges, or nicotine patches. The other very popular medication is Shabyasachi, which has been recently developed by Pfizer for nicotine de-addiction. I'll talk about it in a later stage a little bit. Now, nicotine, as I was telling you, NRT, that is nicotine replacement therapy, the graph shows you the peak that you reach when each time you smoke, and this plateau phase is a graph that shows you how much satisfaction or how much of receptor level blocking